I am Dr. Jolie Thomson. I focus on clinically supported lifestyle correction for treating chronic lifestyle diseases. Here I would like to share my professional experience with this approach. This series is about my experience with patients who took clinically supported lifestyle correction to avoid surgery and reduce and stop medication. This can help you understand how valuable are the lifestyle correction needed for overcoming any chronic lifestyle disease. Most importantly, what advantages such an approach has when deciding on surgical procedures or continuing with the lifelong medication. Here we learn of the approach for a patient who had multiple autoimmune diseases, allergies, metabolic syndrome, ulcerative colitis for 13 years, ILD, that is interstitial lung disease for the last 4 years, Hashimoto's thyroiditis for the last 5 years, dry mouth, that is Sjogren's syndrome, that is another autoimmune disease, and arthritis of the spine, and with the disc prolapse he had put on traction for a long time. Along with this autoimmune diseases and allergic disorders, he is suffering from metabolic disorders like diabetes for the last 6 years, and also hypertension and dyslipidemia and high cholesterol and triglyceride. And cardiovascular disease also, he has put on a stent also. And even after that also, now also he is suffering from palpitation and anxiety, tension. Actually, he is almost 16 types of medicines further and almost 20 doses per day. In spite of all these medications, medical interventions, discomforts are continuing. He is advised to do surgery for a hernia also. Here I will try to explain how the surgery could be avoided, how long it took for multiple medicines to be reduced and stopped, how long it took to get relief from symptoms, and progress evaluation based on corresponding improvements in periodic tests. When we come to the details of the patient, this is a 43-year-old male. His height is 171 centimeters and weight is 68.5 kg, and his abdominal circumference is 87 centimeters. He was diagnosed with ulcerative colitis 13 years back, that is around the age of 30, and then other diseases came actually. Then the interstitial lung disease he was diagnosed, and Hashimoto's thyroiditis for the last 5 years he is taking levothyroxine for that. And he had arthritis, and especially the spine he has been put on traction for some time. And he has allergic symptoms, itching is there, and also the respiratory allergy and asthma is there, along with this interstitial lung disease. And he is having dry mouth is there, and is diagnosed with Sjogren's syndrome, that is also another autoimmune disease. And 6 years back he was diagnosed with diabetes also, and hypertension started after next year. And he had chest pain, and he had undergone an angiogram and angioplasty in 2020. And he is continuing with the palpitation, that is when here some exercise or any effort comes, he is having palpitation is there, and also anxiety and stress also is there. He had consulted with many hospitals and in other systems of medicine like Ayurveda, Siddha and Homeo and all. Because he is suffering for the last many years with multiple diseases, he tried all the options. And he was on so many medicines. And actually there were 16 type of medicines, including 2 homeo medicines was there. And thyroid medicine is there, thyroid 125 milligram levothyroxine he is taking, and Celcept, that is for this mainly for autoimmune disease, that's an immunosuppressant, and Sampras, that is for stomach upset, acidity, and Misacol. Misacol is mainly, that is very high dose, 1200 milligram 2 times he is taking, that is for the ulcerative colitis. Prednisolone he is taking, that's a steroid anti-inflammatory medicine. And Concor, that's a beta blocker, that is for the heart. Palgerin, and this contains aspirin and clopidogrel 2, anti blood thinners, and rosuvastatin 10 milligram for dyslipidemia and cholesterol, and telecast, that is an anti-2 medicines, montelukast and fexofenadine, which is for the allergy, and for respiratory difficulties, Ebiflow, that is azathioprine, another medication is there, and also some other two, a few more tablets are there, so many are there. It's food supplements and homeo medicines also is there along with that. When we look into the blood test and all, he was his diabetes is reasonably controlled. HbA1c in 6.3, sugar RBS actually 185, insulin level is very high, 142.4 is there, and dyslipidemia is under control. Only the HDL is low, and some anemia is there, and no other major problems. But when he look into the allergy and food responses and immunological responses, food and other things, actually he is heavily allergic to milk and milk products, capsicum, MSG is our Chinese salt sort of thing, and also he is allergic to our staple food like rice, potato, oats. It's all having very highly immunoreactive, these foods for him, and it's a very huge list is there actually. Many items he is allergic. Fruits like orange, almond, nuts, cashew nut, raisin nut. So many items he is allergic actually. Next, when we come into his symptoms, main discomfort is chest pain. Chest discomfort and this breathing difficulty we can understand, because he's having a cardiac problem is there, and also lung is in trouble. So naturally chest discomfort is there, skin itching is there, leg swelling is there, and breathing cough with the sputum, that is the major, is continuously breathing and sputum, cough and sputum is there, and also he is having some anal discomforts, piles, it is very often it is coming. In clinically supported lifestyle correction, what is done is actually special food and special exercise. The food is to ensure that all the nutrients for the body is getting in the sufficient quantity. That is actually there is for 57 nutrients including water and oxygen is needed, and 14 vitamins, 14 minerals, around 20 amino acids, and 4 fatty acids and dietary fiber. We are ensuring that all these nutrients are in the correct proportion, and also it is the patient is getting it from which is most suitable for his body or her body, and also along with the try to minimize the toxins which is entering in the body like color, preservatives, pesticides and all, to minimize that quantities also. Then we try to give stimulation for all the cells of the body. Multiple organs are affected, so all the cells to be stimulated. We can stimulate the cells only by doing exercise. Only part in our body which can do voluntarily or stimulate voluntarily is the skeletal muscle. That is what whatever exercise we are doing is for, actually we are stimulating the skeletal muscle. When you stimulate the skeletal muscle, naturally the bones it's all connected to bones. All the bones are stimulated. Actually your immune system is inside your bones, inside the bone marrow. That is the source of all the immune cells. So when we do the exercise, the immune system is getting more blood and it gets empowered. And from the muscles and the bones, certain hormones are coming out, and it will stimulate the whole system, the blood circulation. Whichever part is stimulated, the blood will flow to that part. That is the basic nature of that is the basic principle. And next is to reduce the toxins entering in the body also. That is, the food itself should not contain any color preservatives and tastemakers and all, and also minimize by increasing the circulation and by other means to remove all the toxins whatever is stored in your body, and to minimize this cosmetic also. Nowadays we are all using so many cosmetics, especially the color, this hair colors and ladies lipstick and all. Such things also to be minimized or avoided. That is what we are trying to do with the lifestyle correction, actually, with the clinically supported lifestyle correction. When we come into the result of the patient, when we initially, first we can see the medicines. Actually, the first day when we start itself, this 16 type of medicines we are reduced to actually 10 medications, and also the dose also started reducing. Even the clopidogrel, because he doesn't have a cardiac markers was negative, so both the aspirin and clopidogrel is not needed because it is the stent was put many years back. So after 1 year, the stent we can reduce, and this blood thinners we stopped by 8th day, 15th day, 2 weeks itself, and all the medicines are gradually reduced. The Thyronorm 125 reduced to 8th day, it is 100. Then reduced to 15th day, it is 75, and finally by 90th day we are able to stop all the thyroid medicine, but with a normal thyroid function. That is also very important, not just to stop. The thyroid function should be normal. If the thyroid function is going abnormal, then we have to go back and give the optimal dose for the patient. But this patient is able to withdraw the thyroid. That means the thyroid function also has come back. And Celsipto was stopped. That is a very strong anti-inflammatory medication. That is mycophenolate. Medicines names are all so complicated. It's very difficult to pronounce. So that also initially 500 milligram. It was reduced to alternate day by 30 days, and 60th day it is by 60 days it is over. And Mesocol, that was very high dose. He was taking 1200 milligram. That is mainly for the ulcerative colitis part. And it is reduced, that actually we started reducing it from the 15th day only, because I want to see because it is anti-inflammatory, the stomach itself, if the intestine itself is affected, what we are giving as nutrition also get to absorb. No? So we waited till 15 days to reduce dose, and I first initially reduced to 800 BD, then 400, and then 400 milligram. By 60th day we are able to reduce from 400 milligram. And by 90th day it was no. The prednisolone was stopped. That's a steroid. That is a steroid anti-inflammatory. That was stopped by the initially itself, first week itself, alternate day. Then it is stopped by the second week. This Concor, that is for this palpitation and all. That also we waited because this patient is having tension and palpitation and all. That is actually, this beta blocker is good for that. So we started reducing only by the by the 60th day only, and then it was asked to take only if necessary. If he is having a palpitation, he can take. Then Palgerin and this breath thinners was stopped by 15 days itself, because he is already having so much of stomach and intestinal problems, and this blood thinners, especially this aspirin, created a lot of acidity and problem. Next is rosuvastatin, that is for the cholesterol. The statin he was taking 10 milligram. Actually, it was reduced to 5 initially, then alternate days. And by 30 days, it was reduced. And by 60 days, when he come, he is now on a statin. Without statin, the cholesterol and triglycerides was all controlled. Then the anti-allergic medication, that also gradually reduced. And by 30 days, it was asked to take only if necessary. If he has a problem, he can take. Otherwise, no need for daily use. And next is the anti-asthmatic medicine, Ebiflo. Ebiflo also, that also actually gradually only. Initially we didn't touch because the breathing and oxygen is needed. It's a respiratory relaxant. So only all the other symptoms are okay. It was started reducing, and then also by 60 days he was comfortable without thing, and reduced and stopped, and then also asked to take if he is having, because some allergens in the air and all we cannot avoid many a time. If such a situation comes and he get a busy, then he can take that. So by almost by 90th day, even the last was stopped is actually Thyronorm. All the other medications were over by only to reduce to only if necessary, like beta blocker and anti-allergic and wheezing medicines. All the other medicines were stopped by 60 days, and he was comfortable by 90 days without any medicines. Next, when we come to the blood test, It was he was reasonably even controlled for the diabetic part. He was reasonably controlled. Starting only HbA1c was 6.3 and RBS 185, but on the 8th day his HbA1c was 6.1 and RBS were 80, and 15th day HbA1c 6 and RBS 80 again. And in initially day 1 his insulin level, even though his diabetes and all control, insulin level was very high. The insulin levels maximum is supposed to be 25 or 24 something like that, but he had a 142.4, and but even the high insulin, his RBs were 185. That means insulin resistance is there. It's a type 2 diabetes insulin resistance. So on the 15th day his insulin level come down to 6.96. So the insulin resistance is over. So throughout 60 and 90 days, actually 90 days, his HbA1c only 5.2 without any medicine. Then we take the lipid profile. It's also without that statin was reduced, but the whole time when the beginning itself with the statin it was controlled, and without statin also it was controlled. Not only that, and even with the statin his HDL level was low. That good cholesterol was low, 34 only. The blood parameters, this WBCs and all was abnormal, but also is getting corrected by 90 days. That was not much significant. But with this ulcerative colitis and all, we always prefer to CRP. CRP is a C-reactive protein, is indicating how much inflammation is there in the colon and all. But that also by 90 days, its CRP was only 2.2. So that also significantly, and the thyroid function, this medicine was reduced to, and during the 120 days, 90 days and 120 days also, his thyroid function is all the T3, T4, TSH is normal without medicine. When we come to the symptoms, actually, we have reduced all the medicines. It's gradually was reducing all the medicines. The chest pain, itching, leg swelling and all is over by 8th day itself. Actually, he was comfortable that his next problem was continuing was breathing difficulty and cough. Frequent cough was there with the sputum also. That took it to gradually only 8th day 15% to 70%, that much reduction only. But by 60th day it was almost by 90% it is over. And he had anal discomfort and this piles was there. That also by the 8th day his stomach discomforts and all is very much relieved. But only once or twice he had that recurrence of anal problem after taking some intolerant food. That is also very important. Even though whatever is corrected, some food can create problem. That is the very important in this. Is when during this clinical monitoring time, we are taking special food and adding each items and see what is the response. Especially this sort of patients whose intestine is also affected, we should be very, very careful. Multiple autoimmune disease. So if any symptoms comes, it can be because of the food also. So that should be marked red, and to see how it is another times also. Because when you take a food, it is the ingredient is most important, not the food. It's if you are taking some veg or non-veg curry or dish, there will be so many items are added. So we have to be very specific with each items, and we have to find out which are the items which is creating problem. So that is in a very sensitive way, the patient and also the counseling person or the doctor also to be very carefully monitoring and giving direction during this period. Then we come to what are the importance. The final importance has to be reflected in the body, that we have already discussed with the medication changes and also the blood test. And now we will go into the details of the body itself. Actually, he was, when we are starting on day 1, his weight was 68.5 and BMI only 23.4. That is 23 is okay for the Indians. Upper normal is Indian or Asians is 23. It's slightly high only. And he was on BP medicines. But actually in the 8th day itself, his BP is going down, and 92/70 only. But initially it is 130/80, but we were actually reluctant to reduce the beta blocker initially because of his anxiety and palpitation. But actually gradually reduced. But throughout the course till 120, this BP was perfectly under control. His abdominal circumference was 87 centimeters actually. That actually reduced to 73 by 180 days. And weight also 68.5, but it was reduced from 68.5 to 53 by 180 days, and it was a gradual improvement, and that is reflecting in the fat percentage and abdominal circumference also, 87 to 73 abdomen. Actually, abdominal circumference is indication of the visceral fat. So that is what we want to reduce. We want all the fat store to be excess fat store. Ideally, a male at this age should only have 10 to 15% fat. He had initially the fat percentage when we are starting. The fat percentage was 23.1, but by 6 months it was reduced to 14.6. That is actually this in the fat. Actually, the fat is which is controlling our immune system. Omega-3 and omega-6. Omega-3 is anti-inflammatory, or the healing part of it, or omega-3 controls the healing aspect of life, and omega-6 controls the inflammatory or defense part. Generally, in our food, this inflammatory omega-6 is very high in our cooking oils and the nuts and oilseeds we eat, but omega-3 is low, very low. That is one of the reason for all these inflammatory diseases. These all lifestyle diseases, autoimmune disease, allergy, cancer, all comes under inflammatory diseases. So balancing this is very important, not only in the food but inside the body. That is actually excess omega-6 fat is there or trans fat is there, that we had to remove that. That is only through exercise and controlling the calorie intake we can achieve it. But he is very keenly following this. That is why he is able to reduce the fat percentage from 23 to 14.6 by 6 months. And by the time he is okay with all the symptoms and so many diseases. When we summarize about this patient, actually he was suffering from so many diseases, different types, autoimmune disease, multiple autoimmune disease, allergies, skin allergy, respiratory allergy, and intestinal problem, lungs is affected, heart is affected, so many problems. He was able to get relief within symptomatic relief very fast, within 1 or 2 weeks, and all the medicines over within 2 months. And he was asked for a surgery. Actually, he had an inguinal hernia. When checking during the scan, he was asked for a surgery. He can avoid that also, because now his stomach itself is reduced, weight and the internal fat is reduced almost 10 kg. His starting his weight was 68.5, and for 180 it was 53 only. So the fat is gone. Now he can increase actually weight by building up the muscle and bone also. Only proportionate increase in fat mass. He can actually increase, because he is 171 centimeter, he can increase to 60 kg, but the problem is he is having intestinal problem also. So that it should be a gradual reduction with the most tolerant food. That is the most important thing. And so he is able to avoid a surgery, probably can avoid this hernia surgery. But the problem is, if he gets a respiratory infection and continuous cough or anything like that, it can trigger. So he was asked to, if it is get a respiratory infection, he should use a hernia belt or something like that to avoid stress on that part and protrusion of the hernia or increase of the hernia part. Yeah. Another satisfying thing is actually he's very anxious to see what is his health issues, and he's very attention sort of person. He has gone for a lung scan also. That is not without my advice. He has done for himself lung scan to see, and a lung function test also he has done to see the interstitial lung disease status. And the lung function has increased from 69 to 76 in 90 days. And most probably it will be continuously increasing. And he's done a colonoscopy also. That is also okay. There was no ulcers or anything in the colon also. He's done it around the 90th day. The person has multiple diseases and multiple medications, and he's able to overcome all the medicines before 90 days itself, and symptoms by 3 months or 30 days itself. And if he is future, he should be cautious that he should not gain excess weight. He can go up to 60, but his height he can go up to 60, but it should be proportionate, and he should follow the diet which is apt for him and for his body. That is, we can say only for each person it will be different. So for he has learned how to manage his body, and let him manage it. That is it. Here In clinically supervised and supported lifestyle correction, what we are trying to do is use the healing power of the body by empowering the healing aspect, the anti-inflammatory aspect of the immune system. First is by providing optimal nutrition. Second, by promoting removal of toxins by improving circulation through optimal stimulation of all cells by planned exercise. Third, minimizing toxins entering the body through food, water, air, and cosmetics. Diabetes, hypertension, heart disease, liver disease, kidney disease, obesity, stroke, allergies, autoimmune diseases, and cancer come under the umbrella of lifestyle diseases. 90% of the medications and 90% of the surgeries are for lifestyle diseases. This means that 90% of the medicines and 90% of surgeries can be avoided. In the case of any lifestyle disease, the best treatment begins with the first step of diagnosing the underlying fault in lifestyle that is the cause of the disease. Next is corrective measures to rectify the damage and overcome both the disease and the need for continued medications and surgical interventions. It is good to understand that neither medicines nor surgery can cure a lifestyle disease. To put it differently, it is not a lack of medication or surgery that created the disease in the first place. This is why once medication is started, it becomes a partner of the disease for life. Very often, both the disease and medicines will keep on adding more numbers along with the unwanted side effects, with no hope to return to a healthy status, which not only affects the patient but also the dependents and caretakers. This is why it is very important for you to understand and correct lifestyle while also encouraging others to do so. Another important aspect is when someone is talking about healthcare and treatment approaches, you should consider the scientific background of the concerned person. I am Dr. Thomson, started medical education in Government Medical College, Kottayam as 1981 batch and completed Diploma and MD in Obstetrics and Gynecology from Government Medical College, Thiruvananthapuram, Kerala, India in 1992. After additional training in reproductive medicine, surgery and painless labor, I joined government service. Later, I resigned from government service and in 1997 started practicing as consultant at Lifecare Center, Tevara, Kochi. I focus on lifestyle modulation with the clinical support for lifestyle diseases, minimizing need for medication and surgery. We believe the informed patient is the key to treatment success. You can find detailed content on different diseases, the treatments with emphasis to the benefits of lifestyle correction from website and YouTube playlists. The videos are prepared to understand more about the disease, the possible underlying cause, early diagnosis by understanding symptoms, current diagnostic methods and treatments along with the benefits and side effects, practical aspect of lifestyle self-correction and for those who may require clinically supported and supervised lifestyle correction. When a patient is having more than one disease and there are too many diagnostic and treatment modalities with many side effects, awareness of the benefits and problems of different diagnostic, medical and surgical interventions is the key to regain your health. Better informed patients take better decisions and live longer, healthier, happier lives. I would like to bring to your attention how the major part of the medications we take are excreted in urine, sweat and stool. It will reach the groundwater, rivers, drinking water, plants, animals and food products. That means the medication we take is becoming a threat not only to us humans but to all the life forms on our planet. Therefore, it is essential to correct lifestyle, reverse lifestyle diseases and come out of medications. To protect your children, grandchildren, and the coming generations from the ill effect of toxic pharmaceutical pollution, we should come out of the dependence on medication. The current norm of chronic patients on lifelong medication has to change. Spreading awareness on optimizing and minimizing medication is the need of the hour. Thank you.